Live pictures there of Professor Salim Abdool Karim being vaccinated this afternoon. The needle has literally just come out of his arm, and they're applying the pressure pad afterwards. Of course, he's going to give his first comments after being vaccinated against COVID-19. There's a certain sort of symbolism to this person who's been studying the disease, and of course HIV/AIDS for so long before that. Really, his life's work has been HIV/AIDS and the study of that disease, and better to protect people. And here we are watching him being vaccinated against COVID-19, a symbol perhaps of how much has changed in South Africa over the last 364 days. So these are the scenes now. You're seeing Professor Abdool Karim getting his COVID-19 vaccination, going through that medical process.
I didn't even feel it. In fact, I didn't even know she had already given me the vaccine. I'm turning to see when she's going to give it. So, no pain. It's all good.
I'm sure this must be a very emotional time for you as well. I mean, we've come 360 here in KwaZulu-Natal. You know, the first patient last year around this time, and now you're receiving your first shot of COVID-19 vaccination.
You know, when I put the application in to fill the form in, I initially was allocated to Albert Luthuli Hospital. But when Albert Luthuli Hospital closed down the site, I got reallocated to St. Augustine's. And I thought that how apt it is that the very place I came to originally, and I worked with Heinrich and Craig in understanding how this virus actually spreads. It was right here. And so I felt it was particularly apt that the system allocated me to St. Augustine's. And so I'm here today to receive my vaccine, just as a way in which to recognize all that has gone in the year before. And I hope that in some small way, when I get my vaccine, as I've got my vaccine today, that it will encourage all of you out there to go and get your vaccine when it's your time. Healthcare workers, this is a vaccine that can protect you. Now is your time. Please go forward, get your vaccines.
Professor, do you know what kind of symptoms you're going to be experiencing after this vaccine?
So I wouldn't be a good doctor if I didn't go and read it up before coming here. So I know what I'm going to expect. So the most common symptoms revolve around the site itself. You should expect to have a little bit of pain. You don't see induration and other things that you see with some other vaccines. And then you get the systemic symptoms, not related to the site. You get a bit of fever, you get a bit of chills, and you get a bit of muscle pain. So that's what I'm expecting. From everything that I've seen from the others, and I've been now at the vaccine sites in Prince Masheni, it's really been very minimal. The side effects have been minimal, and most of the people have felt fine. So I'm going to be one of those that goes through a symptomless course with the vaccine. But I know that any side effects I feel will not be anywhere near as bad as if I got COVID-19.
Professor, obviously this means you still have to adhere to the regulations. A warning to those as well who got the vaccine?
Very important. When you have a vaccine, it does not mean that you can now forget about all the other prevention measures. Every vaccinee has to ensure that they continue wearing their mask, ensuring that they maintain their social distance, and do all of the routine hand washing as normal. The vaccine is not 100% effective. No vaccine is. So you still have to protect yourself. And I intend to do so as in the same amount of diligence as before I was vaccinated.
That is Professor Salim Abdool Karim. He is, of course, just been vaccinated, and we've been speaking to him briefly. He says a reminder that when a person gets a vaccine, they still need to adhere to those regulations, and also saying, healthcare workers, this is your moment. Come forward, take your vaccine. You've been the frontline soldiers of this pandemic that's really brought South Africa almost to its knees for a year. And so as we enter into the second year of COVID-19 in South Africa, and we see the rollout of vaccines, we are on alert level 1. He says we still need to adhere to the regulations. Stephen.
Corinda, it's a really interesting moment, a really important moment, and obviously he's going to talk up the importance of vaccines. He's also not scared of a needle, is he?
Absolutely not. In fact, just as he was walking here, I asked him, how are you feeling? And he put out his hand. He said, it's not shaking. And, you know, just before, you can see he's right now smiling for pictures, showing off the part where he got his jab. And we know Professor Karim to be quite an enthusiastic man in all of the briefings and discussions that we've had with him. He's not scared at all. In fact, he's excited. And also, just earlier on in the media briefing at Caprisa, where he's also a director, speaking about the fact that it is an important moment for him to be here at the St. Augustine's Hospital. He says this is the place where he learned about medicine. This is the place where he grew his skill, where he earned his talent. And of course, for him, it's really a full circle to come here. Again, he speaks about the lessons that we've learned over the past year, and says, of course, that going into 2021, we all need to work together, especially as we see the unrolling of vaccines. He reminds us, with regards to the controversy around the J&J vaccine, that while it is a rollout, it is also a chance for people to collect research and rather to collect information as to how people are actually dealing with this vaccine. He says he should be experiencing some mild symptoms, but nothing is to worry about. He's going to be going back to work, and of course,
I have to go for 15 minutes and sit here for symptoms.
Are you going to sit here for symptoms?
You have to. It's a requirement.
But what are you going to be doing tomorrow? What's next for you in 2021?
Back to normal. Meetings, work, reading papers. Back to normal.
Back to normal. Thank you very much.
Thank you.
Karim. On his way back to normal, he says just a little break to make sure he doesn't have too much of symptoms. But after this, the next day, back to normal. Back to you, Stephen.
Corinda Jacques-Mahan, thank you very much indeed for your live coverage. Did you know